Thank you. And welcome, everybody. We're so excited that you're here with us. But before we get started, I wanted to do a land acknowledgement. And certainly, following that beautiful music that we just heard, I think this is very fitting for us. At the end of 2024, we saw the passing of the Honorable Murray Sinclair, who led the Truth and Reconciliation Commission all across Canada. And that truth and reconciliation recommendations, and particularly those that are associated with health, are very important to us. And what I say as an organization, when I read the quotes that Honorable Sinclair talked about when he presented the findings of the report, it really is so much work that we have done, but so much that we continue to do. And as an organization, I absolutely am committed to doing this work for this community and for our community at large so that we can move forward with health equity for everybody throughout the Durham region. So with that, I think we'll go ahead and get started. And wow, what a crowd. We're so excited. And thank you to the organizing team and to everybody who came out today to share this inaugural event with us. We're really proud of it. And we hope that this is going to be an annual event for us. So getting started, we're absolutely appreciative of everybody who's joined us. But if I could get some of our honorable guests to stand up, and if I could get you to hold your applause until the end. I want to acknowledge some people that joined us today, and what I would say is these individuals continue to be supporters of all things Lakeridge Health. They are absolutely in our corner for all of our communities and for our region, and for that we're absolutely grateful and appreciative. So if I could get our MPP for Whitby, Lauren Coe. And so, Lauren, please stand, because at the end, I'm hoping we can give an applause to all of you, because you all work tirelessly in our communities, and you're huge supporters of us in Lakeridge Health and everything that we're trying to do to build the best healthcare system throughout the Durham region. And I can tell you, each one of these individuals work tirelessly to support us. So next from the Ajax Council is Marilyn Crawford, who's the Deputy Mayor, as well as Regional Councillor Ward 1. We have Nancy Henry, who's, she's trying to get more applause. Ajax Councillor Ward 2, and Joanne Dice, Regional Councillor Ward 3. And we also have one other councillor, Lisa Bowers, who's joining us as well. So I certainly want to acknowledge all of those individuals. So please join me in their applause. Thank you so much. And so I also want to acknowledge where we are today in the holy month of Ramadan. And so for the individuals that are here with us tonight that are celebrating this, we thank you for coming. Ramadan Mubarak to all those who are observing. I also want to share with you that during our break, we do have designated prayer space. We also have water and dates that will be available throughout the evening. And I know there's many people in the room that have green on. I unfortunately own nothing green, even though redheads usually do. So I would say happy St. Paddy's Day to everybody who's also joining us as well. Somebody said to me, why did you organize this on Paddy's Day? I'm not sure that we understood all of that calendar, and we were just really excited to get going. So I'm going to go quickly through this. And there's an agenda on the tables. We're hope that we can share a whole bunch of information, not only about Lakeridge Health, the tremendous women that work in our organization in so many areas you're going to hear from tonight, as well as the tables in the back to talk about all the things that are possible at Lakeridge Health. We want to hear from you, so there's a code on your table. If you scan it, we really do want to make this meaningful for everybody who took their evening and came out with us tonight. So please provide that feedback. We also want you to stay connected with us. We have lots of social media, newsletters, and if you'd like to be part of that distribution, we invite you to scan this as well so that we can share with you. And then I'm quickly, very quickly, because I have a lot of slides, but I'm going to go very quickly. Somebody at my table said you need to put on your fastest voice, and I can probably do that as a Newfoundlander if you haven't picked up on that already. But Durham region is one of the fastest growing regions in Ontario, and right now Lakeridge Health is the largest community-based hospital system anywhere in Ontario, because of the depth and breadth that we have. And so I know some of you might know pockets of Lakeridge Health. What I want to talk about is the entirety. So you can see we have a system of hospitals throughout Lakeridge Health. And you can see the 5 locations where we have hospitals and growing. And within those, we have emergency departments. The only exception right now would be our Whitley location. And then we also opened a new long-term care home, 320 beds, the first long-term care home in our system, and it's located at our Ajax Pickering campus. And this past year, we also celebrated the grand opening of the Jerry Coughlan Health and Wellness Center. Through the generosity of the Coughlan Foundation, we opened a standalone surgical center in Pickering. And what's interesting about this piece is within this standalone surgical center, we've also partnered with many other providers. So there's 10 primary care providers in that location. There's lab, diagnostics, and soon to be many other things. We occupy the top 2 floors, and we do all day surgery from this location. Not all day surgery for Lakeridge Health, but day surgery is the component that we do at that location. And then we also had a merger with Durham Mental Health Services. And so that gave us a footprint in terms of mental health and addictions throughout the Durham region. And again, makes us one of the largest providers outside of Toronto and Ottawa for comprehensive mental health and addiction services. And each of our sites, what we talk about is the puzzle that we're trying to create throughout the Durham region. So each of our sites would have a designation of a center of excellence. And you can see on this slide some of those centers of excellence that we have. And we'll continue to think as we grow throughout Lakeridge Health, how we avoid duplication and how we bring services, those comprehensive services, closer throughout the entire region, so you don't need to actually travel outside of our region for the care that you need. And again, so for this one, in terms of the mental health I've talked about, I'm really proud of the team that we have, and many of them are here with us tonight. Just true stewards of healthcare, tons of experience and expertise. I get to be the spokesperson for Lakeridge Health, but we are successful because of this team of individuals who work so tirelessly to make our system the best that we can do in so many areas, whether it's quality, whether it's finance, whether it's medical services, and I'm just really grateful for this team. We often talk about, we're a large healthcare organization. We're actually the largest employer in the Durham region. So we're actually one of those economic driving engines in Durham. We have over 9,000 employees, staff, physicians, and volunteers in our organization, and continuing to grow even more. You'll see that tonight we have an opportunity to hear about the jobs that are available at Lakeridge Health. I saw so many volunteers with their blue jackets or aprons or shirts, and all of that is possible because we work together to try and build a better system. So what does it mean when we talk about an integrated care system? And this is our vision, one system, best health. So I described all of those bricks and mortars that we have throughout the Durham region. And when I think about it like that, what we want to do is make sure that they're all connected. And when we talk about a quality of care and a standard, we hope that throughout our region, no matter which site you go to, there's an expectation that you're going to receive a level of care. If you're coming to have, surgery and you go to any of our sites that offer surgery, we will have a standard that is consistent across Lakeridge Health. So that's how we think about integration. The other piece is the people that work in our organization, the ability to move around, the ability to transfer, the ability to complement and support each other. Again, another notion of what integration looks like. And then finally, when we go from a care perspective, integration really to the client, patient, or resident is a seamless continuum of care. And I can tell you we need to work tirelessly on this. We've come a long way, but we still have a long way to go. People expect that we will break down their barriers, that we will ensure that we're coordinated and we do handoffs of care to make sure that their experience is the best that it can be. And so when we describe one system, that's what we mean. And then finally, best health is through all of those things that I just described, it leads to better outcomes for people and the best health that hopefully we can continue to provide throughout the Durham region. This mission statement and the values that we have for Lakeridge Health, we're going to continue with this statement. We're in the midst of the next strategic planning cycle, but we believe that this is so relevant even today that we're going to carry it into our next 5-year cycle. What we are going to do is look at the priorities that will fall under this that will be slightly different, and I'm going to share some of that with you. But this statement is going to be a guiding light for us for several more years. And this is a picture of the Durham region and the area that we support. Sometimes people say, well, where's Uxbridge in that? Uxbridge falls within Oak Valley, and that would be one of the only organizations that don't fall within this Durham catchment. And I've talked about this before in terms of we have to be ready for the future. Our population is expected to double in size. And that doubling in size is really important because it isn't just more people. The demographics of what's going to happen in our region is going to change as well. We're going to have an aging population, and the growth is going to come from immigration. It's going to come from people moving to Canada, immigrants to Canada, newcomers to Canada, and how we respond as a health system needs to change. We need to make sure that we break down all of the barriers that sometimes exist in terms of health inequities. And this is our commitment to the region of Durham as well. This is an exciting slide, and I think you were with us that day, MPP Co. Wow, and when I say so many people work tirelessly on our behalf, this is it. On August the 1st, we saw the biggest announcement for Lakeridge Health in the Durham region. We received a $10 million planning grant to move forward to start to address some of those growing needs in our community. We got recommitment to move forward with our Bowmanville Hospital redevelopment, which is in phase 2, and that hospital is going to double in size. We received approval in a planning grant to start to think about a new hospital in Whitby. We received planning dollars to look at a complex continuing care home in Pickering. We received dollars to look at advanced services for both Oshawa and Ajax. So really, it was the government signaling to us that that mission that we're on around building this integrated care system was supported in terms of the planning dollars that we had received, and just very grateful for so many levels of government that have helped us make this a reality. So the other thing I want to talk about is some of the challenges, though, and tonight I know that there's Queen's University here as well as others in our Durham OHT that really is trying to address this issue. There are many people in Ontario who don't have access to primary care or primary medicine. Durham, they estimate somewhere around 80,000. We're absolutely committed to trying to make sure that every single person who lives in our region is connected to primary care. And so it might not be directly with Lakeridge Health, but we want to make sure that we're good partners and that we make those connections, and we absolutely support everything that we can to make people want to move here, because when you move, you're going to get connected to primary care, and ultimately that's our goal at Lakeridge as well. We're really proud. We're going to enter in September our 3rd year of our partnership with Queen's University. So people often talk about huge, big, wicked problems, and that access to primary care is one of them. We started the first of its kind in Canada, a medical education program to train family doctors. It doesn't exist anywhere else. In September, we'll have actually 60 medical students that will be connected to Lakeridge Health They'll be throughout the Durham region. They'll be training and learning and hopefully stay, because what we know is that this portion of people's lives when they're young and they're in their training and education, if they get connected with the community during this period, they have a tendency to stay. So if you hold any kind of connection to people, please start talking about how great Durham is, because the more we talk about it, the more we're going to be successful in this piece. The other thing we need to lean into is technology. And wow, don't we have technology at our doorstep in Durham? We have Ontario Tech, we have Durham College, we have Trent University, we have Queen's University, but we really wanted to lean into our partnership with Ontario Tech. And so we signed a formal MOU called PATH, which is Partnership for Advancing Technology in Healthcare. Ontario Tech is an untapped potential for us. They have over 5,000 engineering students who are trying to solve real-world problems throughout their training and education. We want to give them those problems, and recently we did actually in a Catalyst Challenge, and so we're really, excited about what this partnership can bring and how we can think about maybe changing and doing things slightly different. The other thing I just wanted to show you is some slides around some advancing procedures that we're doing. So we saw the first installation of a CAT scan in Port Perry. We saw a PET CT scan at our Oshawa location. And what I would say is prior to that, there were many people in Durham region that were leaving every day for that service and that specialized diagnostic test for cancer. There was no option besides Toronto and Ottawa. And this year we saw that installation in Oshawa. And then the other thing we started was robotic surgery. And I know that there's a surgeon here tonight that we're very proud of, who will probably talk more about that. But I can tell you one of the proudest moments I had, not only as the CEO for Lakeridge, but to walk into the OR and the training room to be filled with women. No offense to the men in the audience, but women, a woman surgeon, a woman anesthesiologist, and all the support staff. And it was just so inspiring to think about what we were doing as an organization, and we're so proud of the people that work there. I mentioned mental health and addictions, and so one of the things that we did was we have a central connect where one number, one phone call connects you with a system that we help you navigate. We know it's challenging, we know we're big and complex, and just really proud of this work, and it's going to continue to foster as we move forward thinking about central intake and wait list and how we can improve our system. The other thing that I talked about was just the changing demographics for us as a region. We launched a 3-year plan for inclusion, diversity, equity, and anti-racism. Our 1-year report is available on our website. This plan really talks about what we need to do as an organization to be responsive to those 9,000 people that work in our organization. I say we're a community unto ourselves. And also the people that live and work in Durham region, in terms of you need to feel that when you show up at Lakeridge Health, you're going to be cared for appropriately. We're going to break down as many barriers as we can, and that you feel a sense of belonging. And this is just another slide. We sometimes get dressed up and celebrate with our colleagues as well. And so looking ahead, so what I said is we have capital buildings, we're going to grow, we're going to expand, we're going to move into technology. But I think the message I want to leave you with is we are absolutely committed and dedicated every single day to doing the best that we can for the entire Durham region. And we're just really proud to be your healthcare provider and to host this tonight and hopefully share more about what we do at Lakeridge Health as an organization. Some key takeaways. Ultimately, what we want is that nobody has to leave our region for any type of healthcare service. So when I talk about those specialized services, that's what we're going to do. The other thing is we say that we want to be the place of choice for employment and for care, not just based on geography, but based on trust and respect that you know you're going to get when you come to Lakeridge Health. And I think that's it for me.